You know, it's said that we make a living by what we get, but we make a life by what we give. And to give to this institution, I can't think of a more worthy institution at this time with all that's going on in the world from a healthcare perspective. Such great facilities, so close by, you can't beat it.
Having a strong community hospital is an investment that everybody should feel is one they want to make. By investing in the hospital, it directly leads to better patient care.
By giving to the hospital, you're giving to more than just that. You're giving to your community, you're giving to your neighbors, you're giving to your own physical health, your future strength. You're giving to the time that lays ahead you don't even know about. You're helping us make the best doctors, nurses, staff, so that we can find the best in you.
So when I think of our philanthropy over the years, we've built a solid foundation here in Needham. We have the infrastructure in place to meet the changing needs.
Needham was, you might call it a cottage hospital 10 or 15 years ago. Now on its way to really becoming a community medical center. 25% of our capital investments here have been generated by philanthropy. And the period of the last 2 years, when we were really struggling with some tremendous changes, made a big difference.
And I think at the beginning of the pandemic, we didn't know how bad it was going to get. The money was being spent on the equipment and the staff.
So the pandemic really changed our world completely, how we delivered care.
But our staff was dedicated. It wasn't just a job, it's a calling to be here at the hospital. And that's what's really important. And so when I think about giving back, I think about what they gave us.
What happened during the pandemic especially has made me very proud to be involved with the hospital.
On June 29th, when Norwood Hospital closed,
I heard it on the news, and then I heard it from an emergency department colleague who said something really bad happened because we have all these patients coming to us who have never come to us before.
That was a real shock to our system here. In some respects, people here might say that the closure of Norwood had a more dramatic effect on the hospital's operation than the pandemic itself.
Supporting the staff, motivating the staff during that time, particularly during a time where they're trying to help the community. They're helping us, they're helping the other Needhamites. For us, was very important.
The future is really about meeting our needs. And when you think of the current needs in our community, behavioral health is one of those biggest areas that we are starting to expand the services that a community hospital can provide.
People saw all the masking, the vaccines, the social distancing. But underneath that, I think you saw a huge impact on mental health in the community.
we had to relook at how we deliver care. We had to look at how we were going to keep patients safe.
They care. They really do care. They care about us, about our community. It's not just a job for them. This is, something bigger than that.
When I think about giving today, I think about how that is just going to propel us for the future. And we don't always know what the healthcare crisis will be in the coming years, but strengthening our staff in this local hospital will ensure that we can meet those challenges.
I come in the doors and I just feel calm. I feel the people are so attentive, so professional. This is everybody, from the person you talk to at reception to the physicians you see, all the staff. I think they just have a tremendous feeling of working as a group.
I feel confident. I feel like my family members are in good hands, so they will be safe. When they walk in here, they're not just going to be a number. They will be someone that the team would want to care for them and want to send them home healed.
I never thought I'd be as impressed or as amazed by the people I know so well as I have been. Somebody faces a crisis and you don't know what direction they're going to go. I think as departments, the emergency department, our hospitalist teams, they just really prove their colors and strength and ability to rise to just any occasion and to do it well.
What success looks like now for us is a stable, engaged, and happy workforce and medical staff. That is the key to our success. If our workforce is strong, the hospital will be strong.
It is really indescribable. It just feels fabulous. The fact of having this hospital in the community and the growth for the last 10 years has been amazing.
As a community hospital, it's important in this day and age not only to get by and do well, you have to thrive in order to survive. And if you look at what we were 20 years ago versus what we are now, it's a vastly different place. 10 years from now, it could be even more different.
So of all the things that I do worry about or things that would keep me up at night, having access to world-class healthcare here locally is not something at all that I worry about. And so I feel very lucky to have the services here.
It's one of the major pleasures of my life that I can donate and make things happen here.